Hello, everyone. Happy Thursday and welcome to Something to Talk About Live. My name is Jamie Hinkle. My pronouns are she and her. And I'm the Learning and Inclusion Manager at PFLAG National. I'm going to be with you in the chat and the comments in whatever platform you have joined us from. So if you have questions or anything that you'd like to share, please feel free to do so. And just like every week, I'm going to bring in our host, Jean Marie Nevada. Hi, Jean Marie.
Like every week.
Just like every week for almost 150 weeks.
Wow. It is a lot of weeks we have spent together, Hinkle, but it's even more than that. I mean, we're like past our 10-year mark now.
Yeah, we had our 10th anniversary a couple of years ago.
People will never understand. Never understand. Thank you, Jamie. I will see you a little bit later.
All right.
Hey, everybody. My name is Jean Marie Nevada. My pronouns are she and her, or ella if you use Spanish. And I'm the Director of Learning and Inclusion at PFLAG National. Every single week, we get together to talk about something related to LGBTQ equality and inclusion. And this week, we are talking about the second annual commemoration of HIV is Not a Crime Day. So for those of you who like reading the article, you can go to straightforequality.org/STTA live. And right there, you will find this week's article, which comes from the magazine Pause, and it was Watch the HIV is Not a Crime commercial. It's actually, you can watch two versions of the commercial. It's got some really interesting background on this particular commemoration and some really interesting information I think that a lot of people don't necessarily know is actually happening. So when it was time to have this conversation, I started to think about who might be able to help. And I am lucky enough to live in Palm Springs, California, where we have DAP Health. And so I contacted a friend, and this is why I would like to introduce the Contracts and Program Monitor at DAP Health, Carl Baker.
Hi, good afternoon, everyone.
Hey, Carl, how are you doing?
Well, despite the wind, we're doing okay here in the desert. We're so spoiled. I feel sorry for the modernism people that have all come out probably with their lightweight clothes to get some pool time, and I'm wearing a cashmere sweater.
And now they're going to learn how to fly. I am so grateful for you being here. And so before we get started, I am lucky enough to live in Palm Springs, so I do know DAP Health. But for people who are outside of town, and we have so many people actually watching around the world, can you first tell people a little bit about DAP Health and also what your role is and your role, what you're doing there?
Yeah, sure. So DAP Health is a little over 30 years old. It was originally founded just by the community, by members of the community back in the 80s who were struggling to find healthcare providers for people who were HIV positive. Because at the time, no one wanted to deal with it. We had a wonderful clinician by the name of Dr. Shubha Kakar, who is still with us today. She's an infectious disease specialist. And so for 30 years, she's been working in the HIV field of medicine, and she's dearly loved throughout the Valley. She's admitted to both of the hospitals here, and so she does a lot of work with our HIV patients. But we also became a federally qualified health center a few years ago, about 6 years ago now. And that designation allows us to open our doors a little wider. So we still maintain our HIV patient population, but now we're able to address people with low income, regardless of their ability to pay for any type of healthcare needs, just general medicine. And we still have our specialty services for HIV care and transgender reassignment services. So it's a fun little place to work. We have about 300 employees. I take care of all the contracts and legal stuff, and keeps us pretty busy.
I have to admit that every time I drive by, I get really excited and really proud as I read all of the messages being flashed on the board outside. Yes. It gives you this real sense of pride to know that the organization has turned into so much more than where it started. And we'll talk a little bit more about that evolution in a little while. But, you know, the article that we shared this week and the commemoration that we are coming up on is HIV is Not a Crime Day. And one of the interesting things about it, as I was preparing for the show, is really reading about the fact that many of the laws that criminalize people with HIV, these laws are more than 30 years old, and they exist in over 35 states right now. So for people who don't know a lot about this, who are maybe a little bit surprised by this conversation, can you talk a little bit about what the reasoning behind the creation and passage of these laws was, going back 30 plus years in some cases?
I think the important part to think about is these laws were enacted back in the early 80s. So our understanding of HIV in 1980 is not the same as it is today in 2023. So that's sort of the paradigm you have to look. We've shifted from kind of this fear of this unknown disease. Well, just think of mpox and COVID. I mean, that's more fresh in everyone's mind. When COVID hit, people were just, do I wear a mask? Can I go outside? Can I see my kids? Same thing with HIV. Can this person work in a restaurant? Can they be a teacher? There were so many unknowns that society kind of went overbearing and created some laws. Not necessarily unjustly. There were a few bad actors, and with everything, there are a few bad actors. And those few bad actors really gave the disease a bad name, going out, having multiple encounters with people and not telling them. And this was a heterosexual male having sex with heterosexual females, but that, it's just how it developed. So now that we have U equals U, which is undetectable, which is undetectable, we can take medicine, just a pill a day, or now we have injections that you take an injection every 2 months and you cannot pass the virus on to someone else. So the idea to say that having sex in and of itself is a crime because you're HIV positive is no longer really valid. You're not putting anyone at greater risk than if you had chlamydia or gonorrhea or any other STI. So there's really no need to isolate HIV now than from any other communicable disease that can spread. But we can't treat it to end it, but we can treat it to control it and to prevent it from spreading. And which is our key of getting people to end the epidemic, is by getting tested and getting on medication to prevent your cells from reproducing and keeping the viral limit undetectable. So your undetectable limit, you can't infect anyone else.
Thank you for giving some of the background on that. I actually did not recognize that the genesis of some of these laws actually came from somebody outside of the LGBTQ community. You also really do make an interesting point that at different points during disease outbreaks, there are things that we don't know. There are things that we don't necessarily understand. And it isn't necessarily all driven by bad actors, although I'm sure we could both point to lots of examples where that has absolutely happened over the year. I mean, I remember talks of actually quarantining people who had HIV way back in the beginning. So essentially, these laws are set up so it criminalizes the sex lives of people who have HIV. Are we completely understanding that?
The way the laws are drafted, that if you and I met in a bar and we wanted to be together, I would have to disclose to you before anything happened that my HIV status. And not doing that would be a crime. Even if I'm not infecting you, so even though I'm undetectable, we could have sex for 5 years. You would never become HIV positive from our interactions, but that's still criminal.
So, and that actually kind of brings me to the next place where I am, that we are talking about laws that were created in a completely different time, in a completely different state of mind. So much has changed since then. I mean, we lived in horrible fear, and now we are living where it is a disease people live with. It is not a death sentence that it was. This concept of U equals U is so important. Having said that, knowing where the science is, knowing that you are, a person can be untransmissible, why do these laws still exist today? Why are they still hanging around?
Well, I don't know how political you want me to get on this, but
we're happy to talk. We'll just remind people that PFLAG is a nonpartisan organization, but we are happy to talk issues. I just mean
in terms of the certain states are just sort of stuck in the mud in terms of advancing social services and medical services for their most needy individuals. That's my idea of political. For instance, today, Tennessee is going to eliminate the ending the HIV funding. But it makes absolutely no sense whatsoever. The governor just carte blanche says, "Oh, we're not going to accept this money from the government anymore." So this is free money coming from the U.S. government to the state of Tennessee to help people who are HIV positive. They don't want the money. So I don't know the answer to that question. Here in California, I went to a Senate hearing when 6 years ago, we decriminalized it here, maybe 5 years ago, plus or minus. And there was very little pushback from our state Senate and Assembly members when we were there live speaking to them, saying, well, it's not a crime to be HIV positive. And they kind of understood that. And so California eliminated that law years ago.
It is absolutely stunning to hear stories like what you just told about Tennessee, especially given the fact that we were talking about free money from the government to do something and actually turning that down. And I think it does kind of force us into that conversation about remaining biases and perceptions of who will be affected by this and whether we value their lives or not.
We call it stigma. The stigma is the 500-pound gorilla in the room that everyone wants to avoid. It's like, just the name HIV can cause anxiety amongst a lot of people.
Yeah, it definitely does. You mentioned that you had done advocacy here in California. So when it comes to advocacy on things like HIV is not a crime, decriminalizing individuals' lives, what kind of work in the legislative arena is DAP doing on that?
So DAP is actually forming a 501c4 right now. So a nonprofit. So we are a nonprofit, a 501c3. A 501c4 tends to focus more on fundraising for political activities. It could be kind of thought of more like a PAC. It doesn't necessarily have to be a PAC, but that's kind of the mental idea behind a C4. So that gives us the ability to raise money and to advocate for these legislative changes throughout the U.S., not just in California. Conversely, we're also a part of a group. So AIDS United has a nationwide reach. APLA in LA, San Francisco AIDS, DAP, all the local California agencies, we all belong to that. So that was the call I was on this morning. So we get the national vibe. And so we work with them, and we have visits this week in Washington, D.C. to speak to our congressional leaders about what issues are going on. And it's almost scary to listen mostly to people coming from southern states and the barriers, the hurdles they have to go through for the most basic things, just sex education, handing out condoms. Oh, that's a no-no. In schools, they have to wait till after school, be off school property.
And don't even talk about inclusive health curriculum. That would just
we're not even getting to that.
It is kind of turning around in a bad way. And, I appreciate you mentioning what is happening in different states. So we are very lucky to be in California, where some of the most progressive work is happening. And I never forget that, because I haven't lived here my entire life. In fact, my previous state where I lived for many years, Virginia, in the beginning of this month, actually introduced a bill that would make HIV testing mandatory for anyone who is arrested in the states. And a number of states already have laws.
I saw a headline on that, right?
Yeah, a number of states already have this. Can you talk a little bit about what the reasoning is behind laws like that? Is it similar to what we are looking at with HIV is not a crime, that these are laws that were motivated by older ideas? The part I think that freaks me out is it's happening now.
Unfortunately, in California, we're trying to get everyone who goes into the ER room tested so we can find out, here's someone who we've got you in our hands. Let's find out if you're positive or not so we can put you on meds. The idea of criminalizing it, of someone who's just walking in your door, as I told our CEO yesterday, we have a lot of work cut out for us still. I don't know the rationale. When people are incarcerated, if you're already on medication for HIV, the jail service will continue to give you your medication. But if you're on PrEP, then there's a big gap. So if you're on PrEP, which is the medication people who are HIV negative use to remain HIV negative, jails will not give that to you,
even though it would prevent it.
It's a cost. It's a cost factor. Oh, Texas is even trying to. So currently, there's a trial now going on in the state of Texas. They're under under Obamacare, saying that by forcing them to take Obamacare, they have to provide money for PrEP, and they don't want to do that. So they were saying, well, we don't. You're forcing us to practice medicine when we don't want to do this. So again, there's this money coming from the state government to a state to provide a service for the people of that state who are in need, for a service that is proven to prevent the spread of the disease. And these states are saying, no, we don't want to have anything to do with it.
I'm sorry, as I'm looking at the screen and I realized my mouth was hanging open as you tell these stories. It is absolutely stunning to me. And I mean, at some point we have to start looking at what is your motivation for these laws.
Exactly. Who are you? If you're trying to help your citizens be healthy, you're doing the exact.
Well, maybe we're only trying to help some of our citizens be healthy. Maybe that actually is the unfortunate answer that we are too often having.
Yeah, that's the other thing with stigma. Those of us who are fortunate enough to have primary health insurance, it's great you can walk into a clinic and see a nurse practitioner, a doctor, and get care. But for the poor, again, we saw all of this in COVID, and I'm not saying anything that we didn't just live through for the last 2 years. Those of us who did not have premium health insurance policies that got sick with COVID. Thank God the government was there to provide services. But for that, our death tolls would have been even higher than they were. But we lost way too many people. And I'm not trying to blame anyone or point fingers, but it's a life. We want to save lives. We want to not, as first saying, do no harm. We do not want to do harm. But I think we lose sight of that. We get dollars in our face and political ideas and platforms, but the bottom line is there's someone who's ill and we can help this person cure this, or not cure it, but at least suppress this illness so it doesn't spread.
It is.
For HIV, for Hep C, we've actually have a cure. So now for that one, medical science has actually come up with a cure. I think it's about 3 or 4 weeks of taking 1 or 2 pills a day, and we can cure hepatitis C. That's just astounding. That's just happened in the last 10 years.
Yeah. And so much of this progress has happened, but so much of it is not making it to communities often and individuals who actually need this the most.
Even with the Hep C drugs, they don't get to the rural. Rural America just suffers from healthcare, period. From maternal healthcare to obstetrics, gynecology, the whole life spectrum. We just, for whatever reasons, don't focus equally on healthcare throughout our country.
No, we don't. And actually, this kind of brings me to one of the things that I wanted to make sure that we brought into this conversation, which was DAP Health was not always called DAP Health. It did go by an earlier name when it was originally founded, originally Desert AIDS Project. And it was one of the most powerful responders, especially in the early parts of the AIDS crisis. But a lot has changed. Your name has changed. The kind of work that you're doing has changed. Can you talk about this evolution and why it is so significant? And I mentioned that I love driving by. When you drive by DAP's office, on the board, it says, transgender healthcare is healthcare and reproductive health is healthcare. And
housing is healthcare.
You tell I drive by a lot.
Yeah, we're super, super fortunate. We have a lot of donors in the community, outside of our community also, a lot of people who are very active with DAP to allow us to grow and to do things beyond just treating an immediate healthcare need. We look at the whole person. If I could give you all the medicine you need and you're sleeping out on the street or in the back of your car, you don't have anything to drink, you're eating, a 99-cent meal at McDonald's every 2 days, taking a pill is not your priority. So we are fortunate to have 60 units of housing that were built in 2007, originally that was for people living with HIV/AIDS. We are currently under construction, and it's amazing. It's right next door to our office. To see the framing is going up now, and there's just like, wow, that wasn't there yesterday. So we have 60. Now there's 80 units, and we're building 60 additional units that'll be just based on income availability, and those should be done early next year. We have social services. We have a whole team that just works with people on social services. We have behavioral health. We have dental. So it's really a one-stop shop. Our pharmacy, our LabCorp, or not our LabCorp, we have the lab services, the pharmacy. Also, you can go see the doctor, dentist, behavioral health, get your labs done, pick up your meds, all at one spot. If you need a bag of groceries, we'll hand that to you. Also, bus cards are available. So it's it's all the, it's a we call it the wraparound services. So, people say, well, you're not doing HIV anymore. So no, we're always, and we will always do HIV care. But we've also been able to grow and expand we're working on women's clinic. There's really, you probably know more than I about this, but in the Valley here, there's really a shortage of OBGYNs. So women's health is another thing that DAP is looking at, saying, we've ignored women's health. We just assumed that, hey, it works for a man, it works for a woman. It's like, not necessarily. We're trying to recruit clinicians to work on women's health. We have one clinician who does a great job working with our transgender population. So there's all kinds of exciting things going on. It's quite busy right now.
It really is. And I have to say, I have an acquaintance who DAP saved her life. She went into a related situation, and it was DAP that saved her life. And it made me so aware of the kind of services that you were providing to a community that kind of is a little bit remote, and sometimes it's a little harder to get care. One of the things that we often talk about here is the intersection between LGBTQ healthcare and reproductive health. And you mentioned that there is sort of the women's clinic being built out. Do you think that places like DAP Health and similar facilities are going to be forced to take on more of what is now being left behind because of the way some of laws are changing with reproductive health centers?
Well, so as a federal qualified health center, so we work a lot with other FQHCs. There's only a few in the Valley, but they are designed, they are the perfect instrument for this. It's one thing, I won't say one thing, but it is a thing the government got right. The FQHC program throughout the United States, they help pay for low-income visits for healthcare. It's phenomenal. These people otherwise would not be able to walk through the door to get quality healthcare. It's not like you're sitting in for 5 hours in a sterile environment. You have an appointment, you come into a nice, clean waiting room, your name is called, you go in, you see your clinician, and if you need your services, it's all done right there. We're working also towards, it's called the patient home medical center, but it's that whole idea. This is your home. You come to DAP, it's your medical home. Everything is here. And we also look in terms of housing and social services. So whatever your needs are, hopefully we're here to meet them.
And you're doing a phenomenal job doing it. And it is a beautiful facility, and there's such dignity. I actually got my boosters there. And walking through, I thought, I feel comfortable. I feel respected. I felt welcomed from the minute I walked in the door. And it really does give people, I think, what they don't experience in other places. So this has been kind of a heavy conversation because I've been focusing on what is not necessarily right. Could you give us a little bit of good news that you are seeing in terms of HIV care, treatment, and prevention that people should be tracking?
Well, let's go back to PrEP. PrEP is working. PrEP is a great drug. We just have to get the word out more. Yeah. Some people were very reluctant. It's been around for years now. Some people at first were reluctant on the uptick, but now we've got the minority low-income population still has a long way to go to buy into PrEP. There's just still reluctance to trust the government, especially with Black men and Tuskegee studies. There's still little residue of that around that we have to get beyond. But we can see in the majority population centers, especially LA, New York, San Francisco, the number of men who are few women who are on PrEP is significant, and they are keeping the virus. San Francisco has really done a good job of not exploding their numbers. Even Africa. I mean, some of our clinicians went over to Africa 2 years ago, and they have very robust programs for everyone to down, and it's working. So the question is really for us today is that we have the tools. Yeah. It's just a question of getting those tools out there. And in California, it doesn't matter what your income is. You can still go through Medi-Cal and get the medicine you need to stay healthy.
I think it is such a interesting thing to think about that these tools exist. But the real question is there a mechanism to get them to people? And is there a governmental will in some places to open up the doors and allow that to happen? Because it doesn't just happen when one place is screaming, come here.
Yeah, that's true. Yeah, and again, being in California in big cities, we're really lucky. But rural Arkansas, I'm sure that's a different topic altogether.
Yeah, access.
Just finding a clinic in some of the rural parts of America.
Even basic access to healthcare is people are challenged on, never mind healthcare that might require a disclosure, which is attached to so much stigma. So we do try to wrap up every single class, or every single show class. You can tell that I teach a lot, can't you? Oh, wow. Wow, that just happened. But every single show by giving people something to do and some leads. So as we are looking at HIV is Not a Crime Day, and talking about these issues, could you give people, our everyday advocates out there, a couple of suggestions for how they can get a little bit more involved in HIV advocacy?
Well, there's number one, there's always PFLAG. Guys, a little push. And in every city, in every big city, there is a what we call an AIDS service organization, the ASO, like a APLA, AIDS Project Los Angeles, or Desert AIDS Project. The names have often changed in a lot of these because we've moved away from just focusing on HIV. But again, we haven't ignored it. It's just we've expanded and talk about stigma. Part of that is the name. Some people, it's like, well, I don't want to go in a building that has AIDS written on it because I don't have AIDS. It's like, well, what? I'll go into something that says cancer center if I'm just going to get an X-ray. I don't really. But because of that, in light of that, many names have changed or just gone to initials to ease anxiety of certain patients. But the thing is, there's tons of things to do to get involved. So again, I think PFLAG's like a great way to get involved. If you have no other contacts, that's one way to reach out in almost every city throughout the U.S.
We are definitely here. Carl, thank you so much for giving us some of your time, coming on and telling about one of my very favorite organizations in my hometown here. Thank you for everything that you're doing. Thank you for sharing your knowledge. And please, if we can ever help amplify any messages for you, you know how to find us. We'd love to help.
My pleasure. It's a pleasure speaking to you, John Marie.
Thank you so much, Carl. Well, that brings us to the end of another show. And I think we brought up some really interesting points this week. Things to remember. Often treatments exist, but it is up to other people to push to make sure that people have access. If you are looking for help, if you need some help, if you want to get involved in some advocacy work, as Carl just said, check us out at pflag.org. And if you're looking for our closest chapter, you definitely want to check out pflag.org/find. We will be back next week with another incredible show. We are going back to books again next week, and we're going to be talking with an author of one of the best books that are out there for young adults, which I just discovered actually has also joined the banned books list. So make sure you join us because we've got a great show coming up. We're also going to be doing a really exciting announcement about a PFLAG book club in case you are a bookworm like me. But until then, we will leave you the exact same way that we always leave you. First of all, reminding you that if you need help, visit us at pflag.org and do 3 really important things. Make sure that you run fast, you laugh hard, and beyond everything, please be kind. My name is Jean Marie Navetta, and I will see you next week on Something to Talk About Live. Bye, everybody.